Good afternoon, everyone. This is Dave Iverson, the contributing editor at the Michael J. Fox Foundation and the moderator for our Third Thursday webinar series. We're so pleased you can join us for this one, and we hope you'll continue to do that on the third Thursday of each month at 12 Eastern when we take up a topic that's important to all of us in the Parkinson's community. And that's certainly true of our topic today, speaking of Parkinson's, where we'll focus on the impact of this condition on both speech and swallowing. Throughout the hour, you'll be able to submit your questions to us, and you can use the little Q&A box on the right of your screen. So just type your questions in there, and then starting in about a half hour or so, we will do our best to get to as many of your questions as we can. If we don't get to your question, though, we also wanted to point out that tomorrow at 12 noon Eastern, we're going to do a Twitter chat on the same topic. The hashtag is FoxPDChat. And so if we don't get to your question today or you just want to continue the conversation, we'll be doing that tomorrow at 12 noon. Also, the slides for today's webinar are available for download. You'll see a box called Resource Lists, and you can click on that, and then that document will open up, and you can either save it or print it from there. Two other quick points, and then we'll get started. We know that there have been, and this is a bit ironic given our topic today, but there have been some audio difficulties on some of our previous webinars. We're doing our best to try to troubleshoot and solve those problems. It's a difficult problem to solve sometimes because our speakers are coming to us from all over the country, and so we'll do our best to speak up, given our topic today, especially so, and bear with us, please, as we continue to work on solving those audio difficulties. And last, just want to thank our sponsors for the Third Thursday webinar series, which include Acadia Pharmaceuticals, Medtronic, and Teva. Okay, let's get started with what we're going to be covering in today's webinar, focusing on speech and swallowing. Problems with speech and swallowing, I think it's fair to say, are quite common in Parkinson's, and they can have every bit as much impact on people as can a tremor or muscle rigidity. As voices get softer, it can make communication that much more difficult, and similarly, swallowing difficulties can be equally problematic, and sometimes those can also have serious health consequences. So these are key topics and key problems that we really want to focus on. And so today we're going to talk about how speech is impacted by the disease, what can be done to help improve speech. Now we're going to talk about some interesting research that's starting up about whether or not measuring in speech changes could also help diagnose the disease. And then we'll turn our attention to swallowing, how it's impacted by Parkinson's, and then again, similarly, what can be done to help avoid dangers in swallowing problems and also strengthen that aspect of how you live with this condition. Here's who's going to be joining us for our discussion today. We have a series of people who will be offering their perspectives on this, including Tom Boyd. Tom lives in Dallas. He's someone who lives with Parkinson's disease, and he's become active with the Parkinson's Voice Project, and we're going to be hearing from Tom about how he has dealt with some of the speech issues involved in Parkinson's. Tom, thank you very much for being part of our discussion today.
My pleasure, Dave. Thank you.
And joining us as well is Samantha Ellendary. Samantha is the founder and chief executive officer of the Parkinson Voice Project, which is a national organization based in Dallas dedicated to creating programs to help people keep their voices strong. So Samantha, thanks for being part of our discussion as well.
Honored to be part of it. Thank you.
And here, too, is Dr. Rachel Dolan. Rachel is a movement disorder specialist at the Michael J. Fox Foundation. Previously, she was in private practice working with people with Parkinson's disease in Charlotte, North Carolina. Rachel Dolan, thanks for being part of our program as well.
I'm happy to join.
All right, let's get right into what we want to tackle with our various topics. And we're going to start out by looking at some of the specific issues. And Tom Boyd, I'd like you to just, as you look at this screen and you see this kind of laundry list of problems that can come up with speech in Parkinson's, as you look at that list, what was the issue for you? What did you first start noticing, and how did that evidence itself as a problem?
As far as speech goes, David, the lower volume was the problem. I was in sales and marketing management with a major airline for a number of years, and so my voice, I gave speeches, I did everything, suddenly started getting lower. And it affected people individually when I would be in conference calls similar to this, and so I knew that there was something wrong. I had had symptoms of Parkinson's with other areas, not my voice, earlier, but this started to become a major factor in my life.
And I would think, given in particular your profession, in some ways were these voice challenges then as problematic or perhaps even more problematic than other aspects of living with Parkinson's?
They were. I had retired from the airline at that point, not because of the speech, but because of my age. And simply, it was a major negative factor toward the end of my career. It would have been nice to have walked into the Michael J. Fox Foundation or Parkinson Voice Project and had the help at that point, but it's the afterlife, the time now that it was affecting me, and I needed help, and that's where both of your organizations came into play.
So tell us a little bit, and then we'll get Samantha to expand upon the various treatment possibilities that are there. But say something, if you would, at this point, Tom, about how participating in the Parkinson Voice Project was helpful to you. What did it actually yield as far as an improvement in that volume difficulty that you're describing?
What gave a smile to my life, number one, because of the attitude of the Parkinson's Voice Project people. They're all professional and they're all most helpful. Their program is outstanding, and I've been involved with a number of programs as far as not Parkinson's but other organizations, and this was laid out so perfectly. They have a speak out program that lasts 4 weeks, and you have training with a speech language pathologist. Then you have the Loud Crowd, which is a maintenance group afterwards, which we meet every week at least, and we do our voice exercises, which again we learned at the Speak Out formal program. Then we do reading exercises and we do cognitive exercises. And I've gotten to the point now, 13 months into Samantha's program, where I volunteer at 3 different schools to read to young people, to use the techniques I've learned from PVP. And also I'm expecting this 13th of July to even go to a Barnes & Noble, and while they're having a marathon for To Kill a Mockingbird, they're going to read the story for 12 hours a day in all their stores. I'll be doing part of that marathon, and that's quite a change from 13 months ago when there would be no chance that I could barely be heard by my wife, let alone ordering food in a restaurant or anywhere else.
Well, it's a wonderful testimony to the progress that you've been able to make, and testimony, too, that this is one symptom, one problem in Parkinson's that is quite responsive to various training techniques, and we will talk more about that in just a moment. But I want to spend a little bit more time before we get into some of the training techniques and exercises that can be useful to talk a little bit more about the problems that do come up and why those come up in Parkinson's disease. So, Samantha Ellendary, Tom's issue, it sounds like particularly, was lower in volume. We see these other problems that are listed on the screen, less inflection, problems with mumbling, and then some issues that perhaps get into some cognitive questions as well. But on the things that are purely a question of vocal strength and clarity, tell us why those occur. Why would someone in Parkinson's be prone to speaking at a lesser volume, have less emotional inflection, perhaps mumble or be hoarse? What's going on?
Well, like it shows on the slide, there are 2 main issues related to speech when it comes to Parkinson's. First of all, speaking is a very automatic behavior. I mean, it's amazing that any of us can even speak because it is so complex what has to happen with the breathing and the vocal cords and all our articulators, our mouth, our lips and our tongue and all of that. So it is a very automatic function. When we are speaking, we don't really think about taking that breath in and contracting the muscles of our diaphragm and doing all of that. So we know that with Parkinson's, there's not as much dopamine as there was before, and dopamine is responsible for automatic muscle movement. So now that the patients don't have as much dopamine, speaking is not as automatic as it used to be. So people with Parkinson's need to think about what they're saying. At Parkinson Voice Project, we say they need to use intent. They need to focus, concentrate, be deliberate when they're speaking. And so what happens when they are doing that, when they're using intent, they are using a higher motor track that is less dependent on dopamine. And that's why people with Parkinson's respond so well to speech therapy, because when they use intent, they're using a system that does not require the dopamine. The second part...
Let me just pause there for a moment, Samantha, if you would. I want to bring Dr. Rachel Dolan in to comment on this one aspect, and then we'll pursue your next point after that. But Rachel Dolan, what Samantha is describing about voice being something that is an automatic behavior, that sounds very similar actually to what happens in walking, and that's similarly often in Parkinson's, particularly later in the disease. You have to bring that same degree of intent. You have to think about action. You have to think about taking bigger steps, for example, in a way that is you're bringing intent to something that was once automatic. So in that way, is our vocal difficulties in Parkinson's just part of the kind of continuum that exists in other aspects of the disease?
I think so, and I think it brings up another point that we were discussing, and that somebody submitted a question about, would singing help with speech problems? So that rhythm, when we have problems with walking, we think about, we'll just restore that natural rhythm, that automatic that we don't think about. So would singing bring back the rhythm of speech? And there is evidence to suggest that possibly singing would restore that natural rhythm. So again, to bring back that correlation, that association, I think so.
And Samantha, back to you on if intent is key, is it also this sense of just kind of making things work harder and bigger in a way that they may not have before, whether that's having more breath, whether that's using your facial muscles, your tongue? Is all of that, I guess, a degree of intensity that you have to bring along with the question of intent?
Yes. So there are two issues with the speech. One is that it's not automatic anymore. And then the second part is that Parkinson's is characterized by reduced range of movement. And so we understand that when we think somebody with Parkinson's might take smaller steps, or their handwriting might be a little bit smaller. But all of their movements that they're using for speaking are also smaller. So the real issue is, for example, when somebody takes a breath in, we take the air in and we expand our lungs, then we contract the muscles of the diaphragm to push the air up, it hits the vocal cords, and we start, we make sound. But because the range of movement, because Parkinson's is characterized by reduced range of movement, the person with Parkinson's may not expand their lungs as much as they did before. They may not contract the muscles of the diaphragm like they did before. Their movements are all small. And so when they use intent, they automatically, without having to think about it, and now we say automatically, but it does carry over. When they use intent, they take a deeper breath, they contract the muscles of the diaphragm, they move their lips and their tongue more. And so it's interesting is that Dr. Charcot, about 55 years after Dr. Parkinson first described the disorder, in his essay, Dr. Charcot came in and said he was adamant that people with Parkinson's were not weak. And whenever I talk to people with Parkinson's about that, they go, well, but I feel like I'm weaker. Well, it's not that Parkinson's makes the muscles weak. It's that because the movements are smaller, the muscles become weak. And that's why people with Parkinson's respond so favorably to exercise, whether it be for the voice or the body. Because if they put forth more effort, if they use intent, they can make all their muscles work the way that they're supposed to do. But the hard part with Parkinson's is that they have to work hard to maintain it, and that is the challenge. 25 years ago, we might have thought that there was no point in doing speech therapy because since Parkinson's is progressive and degenerative, that if they did the therapy, it wouldn't make much difference because it's going to get worse anyway. But now we know that that's not it. People with Parkinson's need intensive therapy, but then they need to maintain it. And at Parkinson Voice Project, we have the loud crowd, so that's the maintenance part. But that's the key. No matter what kind of therapy people are doing, whether it's speech or physical therapy, they have to keep up with it. But another issue is the lack of motivation. So people with Parkinson's.
Talk about some of the. Let's move ahead and talk about some of the specific programs that are available, both through the Speak Out project that is part of your work at the Parkinson's Voice Project, Samantha Ellenderry. There's another program also well known, the LSVT, standing for Lee Silverman Voice Training Loud program. And both of these focus on the very things that you're talking about in terms of exercise and constant repetition and staying the course with those things. Samantha, what I'd like you to do, please, is give an example of one exercise, and then Tom, maybe you can be the demonstratee of how that exercise works.
Certainly.
Okay. Would you like me to talk about both programs?
Well, just give an example from one of yours, from Speak Out, of a vocal exercise that you ask people to do, and then Tom, maybe I'll ask you to do it.
Sure. Okay, so the Speak Out program has 6 different exercises, and the first one is a warm-up where we kind of get everything going. We start to use increased volume, but we do it in a way that will not strain the voice. And so, Tom, will you go ahead and do the may, me, my, mo, moo? Now, don't blast us out of here, Tom, okay? Not
All right.
Not too loud, okay.
May, me, my, mo, moo. May,
Very good.
me, my, mo, moo.
That's perfect, Tom.
What is that demonstrating, Samantha?
So what we're doing is we're getting the system going, the respiratory and the laryngeal, the voice. We're getting it going, but we're using the M, we're using the M sound, and we're doing it in a way that will not be straining the voice, but it just kind of wakes everything up and gets it going. And so that is the first component of the Speak Out program. So that's an example. But you can see how when Tom does it, he is stringing those sounds together, so we're stretching the breath support. So it's not may, me. It's not like that. It's may, me, my. So he's over-exaggerating, which means he's moving his mouth more, he's moving his tongue more, he's projecting his voice up and over, we say, and that's why the program's called Speak Out. You know, so that's what, when people do that, when they do project out, we tell them over the mountain, over my head, they take a deeper breath, they move their mouth more, and they're doing it in a way that will not hurt their voice. So it's not about being, too loud or anything like that, and LSVT is not about that either. LSVT is about thinking loud. So, but we want to make sure that we're exercising all the muscles, but we're not hurting them. So by projecting the voice out, by over-exaggerating, we're exercising all the muscles. And I want to point out is that when you do these exercises, the muscles we use for speaking and swallowing are the same. So when you're exercising the voice...
We'll come to the question of swallowing a little bit later on, but I want to go through some of the other aspects of this. I think Tom can serve as Exhibit A for the effectiveness of what this kind of training can offer. But Rachel Dolan, I want to have you underline the point, if you would, that Samantha Ellendary was making about the need for this to be constant. Because I suspect when you were in private practice, again, this is not unlike what happens physically with the disease. It's not like you can just exercise for a while and then you're good to go. You have to stay with it, and that would seem to be the case with this as well.
Yes, this is a good example of you have to use it or lose it. So the LSVT, as you said, is an intensive therapy that happens over 16 weeks. So it's a very intensive course, and you have homework, and you have to continue to do that homework and continue to practice it. And a lot of times this is just practicing reading out loud and doing the same techniques reading out loud on your own time, or just practicing doing the techniques with your spouse at home. But you have to continue to do these on a regular daily basis, or you will just fall out of practice and fall out of these automatic habits.
And there are lots of questions coming in about what to do about very particular aspects of this. So I want to just plunge right in and get to some of those and ask some of you to respond to that, and then we'll get into some of the swallowing issues and other research that's being done as well. But one person wrote in, Rachel Dolan, why is it that symptoms come and go? And of course you could ask that question about any aspect of Parkinson's disease. Is the same true for speech and swallowing, that just as a tremor might be worse than one day, similarly with voice, that it can vary from day to day?
Exactly. So just as motor symptoms fluctuate, so can the non-motor symptoms of speech and swallowing problems can fluctuate as well. And that can be a manifestation of the medications wearing off. So as you get due for another dose of medication, you can notice that your speech starts to slur or get lower in volume, or you have more trouble swallowing, or your medication regimen just might not be optimal in general, and you might have more swallowing problems, in general. But you might have more stress in your life, or more anxiety or depression, or other medical problems that are contributing to things. So just taking into account that other things could be definitely contributing to these symptoms is worthwhile.
Samantha Ellendary, there's a question about hesitation and stammering, and this individual, Simon, wants to know whether or not there's a medication you could do, and perhaps you can answer that part of it. But I'm curious about that problem in particular. If someone has a problem with hesitating, perhaps that also could involve, I suspect, word retrieval. Are there techniques that can address that?
Yes. Would it be okay if I made a comment about the previous about it being inconsistent, the voice, just real
Sure.
quick? So one thing about, why the voice can come and go, we have to build up strength and endurance. And so both of these voice programs will do that. And again, it will happen, also, we have to be, because it's not automatic anymore, we have to be intentional about it. We have to think about what we're doing. It's hard to do that all the time. So a lot of times spouses will complain that the person uses a better voice when they're on the telephone or when they're talking with other people, but when they come home, they can't be as easily understood. And the reason is we are on alert more, and we are using intent more to other people than we are when we're relaxed at home. So that also can contribute to it.
It also means that it also makes it challenging, I think, because it's hard to be intentional all of the time.
We can't be. So that's important for the spouses to realize, and the family members to understand, that it takes a lot of concentration to be at our very best all the time. Just like right now when I'm speaking with you, I'm using intent, and it would be difficult for me to do that all day long, every minute. So that's important. But as far as the hesitation, remember that dopamine is responsible for coordinating our muscle movements. And when somebody has the hesitation or the disfluency in their speech, it's not coordinated. When somebody speaks with intent, and so they're really concentrating, in our program we will say, every word with intent. When somebody does that, they're using a part of the brain that is less dependent on dopamine, and their speech will be more fluent. So I don't know if you notice when somebody's walking, for example, and they start to stammer a little bit in their steps, and then if they would just stop and then focus, and like the big program says, take big steps, they will be more fluid in their walking. And it's the same way with the stammering or the hesitation. When somebody has that issue, if they try to push through it, it's not going to work. They need to stop, regroup, and then use intent.
And if I could build on that for, exactly back to that walking with the stammering in the walking, you can have stuttering in your speech. So, most people have slower speech or, more cautious speech or hesitancy in their speech, but there are many people who have faster speech or stuttering in their speech. And, back to just like we talked about in the first few minutes of this conversation, back to the walking. So it's, that same kind of fluency issue.
Rachel Dillon, there are a couple of people who want to know whether or not there are medications that can be helpful with speech. And a couple of people are also asking the question about deep brain stimulation. Deep brain stimulation, of course, is a surgical technique that's very effective for relieving tremor. And there's lots of interest now in finding other locations within the brain that might also then respond to or help people respond to more problematic symptoms, including balance and perhaps also speech. So bring us up to date on beyond the kind of training that Samantha is focusing on that has proven to be so effective. Are there other things out there that might be helpful as well?
So while there aren't specific medications specifically for the speech problems in Parkinson's disease, I think that there can be a lot to think about with regard to adjusting medications to help with the speech problems. And as I mentioned before, thinking about, do my speech problems get worse as I'm toward the end of a dose of medication? Or do I really notice, as I get fatigued toward the end of the day, are my speech problems much worse? And then you can work with your physician to figure out, do my medications need to be adjusted so that I have a more optimal medication regimen to get better results on my speech. As far as deep brain stimulation, there has been a small study of a small number of patients on adjusting the parameters of the deep brain stimulation in order to see if lowering the frequency of the stimulation would actually help the speech troubles. And that was shown to be beneficial in people with speech troubles.
So there may be some additional things out there, and we're going to talk a little bit more in just a moment about other aspects of research. But before we move on to that, Samantha Allendary and Tom Boyd, I'd like you to chime in on this as well. I mean, I think the key point that we want to underline here is that as problematic as speech difficulties can be, there's lots of research now and lots of testimony, as Tom Boyd has already given us, for how well these particular techniques, be that the one that you've developed, Samantha, or the LSVT approach, this is something we know can make a difference.
It does.
Really
I'm sorry, go ahead,
Samantha. Go ahead, Tom.
Tom, go ahead first, and then Samantha.
I was going to say professional programs like we talked about make a huge difference with the speech, but very honestly, you do need to put forth the effort, and that's the intent and the purpose, but you need to work at it not just once a week or not just, in other words, you've got to do your homework. We all know that in school, to get ahead, you have to do that, and that's the secret with these programs as well. You can't just do it once a week and expect to have everything solved. As far as a regular basis goes, you really need to work at it every day, at least 15, 20 minutes, if not twice a day. And then if not, if you find yourself with other things, certainly people that are still working, etc., you're talking about at least 3 to 5 days a week, in my opinion.
And Samantha Allendary, what percentage of people would you say your project or the Lee Silverman Voice Training Project is able to help? I mean, Tom, again, seems like exhibit A of what can be done. What would you say the success rate is?
If a patient will do the exercises, whether it's LSVT or speak out, they will get better. I have worked with people with Parkinson's since 1997. I can think of 3 patients that whole time, so this is nearly almost 20 years now, who could not benefit from treatment. And one patient was a woman who had not spoken, had not made a sound in probably 5 or 6 years. And so she could not coordinate the breathing, so she was not a good candidate for treatment. And the other 2 people had the bilateral pallidotomy, which I don't think they do anymore, but it just wiped out the speech system, and so they were not a candidate for treatment. But both treatments will work. They are different, but the key is for anybody with Parkinson's, again, goes back to speech or physical therapy. It's about high effort, high energy, and daily practice, and continuing to practice after the treatment. So they need to work with a speech pathologist who knows how to treat Parkinson's. Unfortunately, in graduate school, speech-language pathologists don't learn about how to treat Parkinson's. And so that's why it's very important that we do the training for it, and we hold workshops at our clinic to train speech-language pathologists in how to conduct the Speak Out Loud crowd programs. But the patient has to practice daily. So if they are doing therapy 1 day a week, and not doing anything on their own, they will not get better. And in fact, at our clinic, we will not continue to treat someone who comes in and does not do the daily exercises, because there's really no point. The voice will drop, and they will not make progress, and they will not keep it. So they need to do the exercises.
A number of people are wanting to know where they can find providers and resources, and so if you go to the resource list that's available for you to print or download and print later, that'll give you some of the possibilities for where you can find assistance in your particular area. Let's move on and talk a little bit more about some research aspects, and then we're going to dig into the swallowing issues. Lots of questions coming in about swallowing, saliva, those kinds of issues. So we're going to get to that, but we want to talk a little bit first about some interesting things that are going on now with regards to research into whether or not, Rachel Dolan, speech can become a way as a kind of diagnostic tool. As we all know right now, there isn't a definitive biomarker for diagnosing Parkinson's. It's all based on a clinician like you observing certain kinds of things. And the question is whether or not speech could become one of those markers that might allow us to get in on the disease that much earlier.
So because speech might be subtly affected early on in the disease, and because the majority of us have smartphones, and because we talk all day long, is this an easy thing that we can look at in order to see, would this be something we can analyze to see, would it help us diagnose Parkinson's, and would it help us monitor Parkinson's? So the Parkinson's Voice Initiative was a study in which mathematicians analyzed voice messages and were able to delineate between people with Parkinson's and without Parkinson's just based on a telephone message that they left. So based on that data, they are expanding into looking at data that's just put into your smartphone. So this is basically what we're looking at through the smartphone apps like Empower. So where you just log on to the app Empower and just say into the microphone of your phone for a few seconds every day, and then that can log basically the quality of your voice, the tone of your voice, the strength of your voice, and follow over time how strong your voice is, and again just compare that to people with and without Parkinson's to see, can we determine what your voice sounds like versus somebody without Parkinson's, and then how your voice changes changes over time to see would speech be an adequate marker to help us make the diagnosis and follow Parkinson's over time.
So one more way in which we can begin to get more precise, it sounds like, about not only the diagnosis of Parkinson's, but also, as important, tracking things over time. Because right now it's hard to know sometimes. You can only kind of go by kind of gross clinical observations, how fast someone is tapping their fingers and the like. This could be one more way of measuring progression in the disease. Let's move on and push on to swallowing at this point, because there are a number of questions coming in on the question of swallowing and what's going on with swallowing in the disease. So as we go to that question next, Samantha, perhaps you can first describe whether or not the same mechanisms that you've described as going wrong in speech is the same issue in play with swallowing. In other words, the lack of perhaps that it's also automatic, perhaps that you don't have the same kind of muscle control or strength. Is the problem in swallowing connected, I guess, to the problem in speech?
Yes, it's the same muscles. We use the same muscles for speaking or swallowing. And so, for example, I have a lot of patients that talk about the excessive saliva. And they think they have more saliva than everybody else in the world. But the issue is that swallowing is an automatic behavior. So throughout the day, we are swallowing and we're not even thinking about it. And so people with Parkinson's may not swallow automatically as much as they used to, and then the tendency to tilt the head forward, then that can cause the drooling. And but with swallowing, I mean, it's been reported that as many as 95% of people with Parkinson's can have difficulty with swallowing. Speech therapy can help if it is a mild to moderate disorder. At least that's what we've experienced at Parkinson Voice Project. So we looked at 130 patients that we treated using Speak Out, and 70% of them said their swallowing was better afterwards. I know that there's been some studies with LSVT also, and there's also a researcher at Texas Women's University who is currently studying the effects of swallowing, Speak Out on swallowing. But yes, the problem with the automatic issue, and then also the reduced amplitude of movement, reduced range of movement. People are not moving their mouth as much or as big of movements as they did before. So, for example, somebody chewing their food, if their mouth and tongue are moving in smaller movements than they used to, then it would take them a longer time to chew their food, take them a longer time. Those movements, when we're swallowing, we're moving the food to the back of our throat, and so the movements are smaller, and so that movement of moving the food to the back of the throat, it becomes more difficult, and the swallowing becomes slower. And so, but definitely, what we do at Parkinson Voice is that we go through the Speak Out program first, and then if the person is still having difficulty swallowing, then we would refer them for a modified barium swallow, which is a test, like a video, to look at the patient swallowing, and then they may need to have some specific swallowing therapy to help them. But I would try the speech therapy first, because chances are very good that the swallowing will improve with that. But again, the patient has to keep doing the exercises daily after they finish the therapy. Otherwise, it'll go right back to where it was before treatment.
And Rachel Dolan, a number of people are wanting to know, is this going to happen to me, essentially? What's the likelihood that these problems will occur in Parkinson's disease? You heard Samantha make the reference that in some studies, at least, it's quite prevalent that people will have that. So what can you add to that about the likelihood that people will have these issues? And if you have one, will you have the other? In other words, if you have speaking issues with volume, does that mean you'll necessarily also have swallowing problems?
So estimates vary, but I think anywhere from 60 to 80% of people can have some problem with speech or swallowing at some point in the course of Parkinson's disease. But again, that doesn't necessarily mean that you are destined to have one of these problems, and everybody's Parkinson's disease is different, and you can be affected to different levels. So, your speech problems may be something as subtle as, slightly lower volume. Your swallowing problems may be a little bit of, difficulty swallowing, or just a little bit of feeling like something's getting caught in your throat, not necessarily significant problems with swallowing. Speech and swallowing problems can go hand in hand, but I don't know that 100% of time they always have to. I think clinically what I would see would be that people would have speech problems kind of precede swallowing problems, and be maybe a little bit more subtle before the swallowing problems came. If they were more severe and people had more significant swallowing problems, then speech and swallowing problems were more, hand in hand.
And say something more, if you would, Rachel Dolan, about the saliva question, because a number of people are writing in about that. Is the problem that because you have trouble swallowing, therefore you have more saliva? Or is there something about the disease that creates additional saliva? What's the chicken and the egg, I guess, in that question?
Yeah, so it's just exactly as Samantha said. People with Parkinson's, just as we blink less and we have, less movement, slower movement, people with Parkinson's are swallowing less. So there is simply just a buildup of saliva that we're not swallowing. So the saliva builds up and drool ensues. So there are a lot of things that we can do about this, though. There are medications that can be used. Now, every medication has side effects, so we need to think about the possibility of side effects with these medications, but there are medications that can cause a drier mouth that can be used to lessen the amount of saliva. There are Botox injections that can be given into the salivary glands that can dry up the saliva. And you can also suck on hard candy. We prefer sugarless, but you can. This is one instance where a doctor might tell you to eat some candy, but that can help with the salivary problems.
We're going to put up on the screen our last slide about, and we've already reviewed much of this, about the things that can be done to impact swallowing, and Samantha and Rachel have already reviewed a number of these items, and so we'll also use this now as a springboard to take up more questions about what can be done with both swallowing and speech difficulties. And there are a couple that I'd like your comments on, Tom Boyd, if you would. One person raises the question, when is it time to take action? When should you talk to your doctor about speech or swallowing difficulties? When do you know that it's time to do something? What would be your answer to that?
My answer would be when it affects your way of living. So if you're starting to choke with food or liquid, because you can also choke on liquids, that's certainly affecting your life. If it happens more than a few times, certainly go to a speech-language pathologist first if you're in one of these programs. But number two, if it bothers you and it becomes a health menace, since it's not automatic like it used to be, then you need to check with them.
And similarly for speech, right? I mean, this was something that you discovered because it was affecting your life experience.
Correct. It was after the initial diagnosis of Parkinson's with the tremor is how I was initially diagnosed. But it makes a huge difference when you get into a program and I use intent and focus now on whether it's handwriting or walking. You need to think those things out, at least I do, and a number of people. So you need to work on those specifically and don't assume automatic anymore.
And the reason I wanted to get your thinking about this a little bit, because I think sometimes we think once we have a Parkinson's diagnosis that the question is, when do you talk to your doctor about it? In some ways, it's when do you talk to yourself about it, and when do you talk to your spouse about it? And the answer you're giving us is it's when it affects your life, whether that's how well you speak or how well you swallow or how well your handwriting is going. And this leads to the next question I wanted to ask you about, Tom, and Samantha, you may want to chime in on this too, but Tom first. A number of people are asking about the question of motivation. Someone has written in, what if my partner doesn't have the motivation to complete these programs? What do I do then? And Tom, you're obviously someone who has maintained your level of motivation to do this. Give us your thoughts on that. What allows people, or what's allowed you, I guess, to stay the course so well?
Well, I appreciate it. I look for the end result first. I've been a high achievement person, but actually very laid back in my life. So I know what the end result, what I want to accomplish. And if I can't do it one way, I'll figure another. I know there are people, friends I have that also have Parkinson's, that say, well, I don't want to do exercises more than once a week. I don't even want to do it. I'll come to the weekly meeting. That's totally counterpoint to the whole idea of improving, like Samantha and Rachel talked about, and yourself, Dave, that you need to find whatever motivates you. It's like a runner, and I'm not a huge sports person anymore, but you need to figure out what gets you to the next milepost. And you do it in small segments that way. If you went through one of these programs and did not work every day, then you say, well, if you work 3 days a week or 5 days a week, I agree with Samantha, you need to basically do it every day. But if you can't get someone to say, well, let's try it twice this week, you did it once and you're saying you're having problems, whatever will improve the person's home life, even if it's an individual by themselves, they can still have things they want to do, and if they're not doing some sort of a program after diagnosis, then they're just losing the opportunity to live a better and a more purposeful and intentful life.
And Samantha, add briefly, if you would, to that about what you've discovered over time that keeps people engaged, keeps people motivated.
Okay. Now, I want to make a comment, though, about when somebody should seek out treatment. Can I talk about that real quickly? Because there's a mathematical equation for this that I think people need to be aware of. Normal conversation is around between 70 and 74 decibels. Now, if somebody goes through speech therapy, typically we will see an increase in conversation. I'm not talking about the other exercises, but we will usually see an increase in conversation by about 6 to 8 decibels. Of course, there could be less or more depending on the patient, but typically we can achieve, get a good 6 to 8 decibels increase in conversational speech. And remember, normal is around 70 to 74. If somebody comes to see us and their volume is measuring 65 decibels, they go through therapy, they're going to be able to get their voice back up to a normal level. Okay, but if somebody waits, let's say I've had people who come and their volume is registering 55 decibels. No matter how hard that person tries, they have lost the ability, or they may have lost the ability to ever get their voice back up to a normal level. So early intervention is important. And I just want to mention, for those patients that have waited a long time, that doesn't mean don't do therapy. Your speech will be much better if you increase the 6 to 8 decibels. And what I do sometimes is I will treat somebody who's really having a hard time, treat them, get the 6 or 8 decibels, and then in 6 months, when they get used to using that stronger voice, then I'll do the treatment again and try to get some more. So I definitely don't want to tell people not to do the treatment, but I want them to do the treatment as soon as they can. And also, there is a sensory, besides the motor deficit, there is a sensory deficit related to speech, so that people with Parkinson's a lot of times don't notice the speech difficulty. Their spouses will notice it before they do. So it's not unusual for the person to say something and the spouse says, "What'd you say?" And the person with Parkinson's says, "Well, you need a hearing aid." So there's a lot. So it's not unusual for the person with Parkinson's not to recognize the disorder. So I would say for all the people on this webinar right now, if your spouse is telling you that your voice is not as strong, or if other people are leaning in and asking you to repeat, then please have it checked out and find out if you need the treatment. But the other part you talked about, oh, go ahead.
Yeah, I'm just going to push us on to some other questions, actually, because we're running short on time, and I want to get to more of our questions if we can. This raises a question, Rachel Dolan, about preventative. As Samantha is pointing out, better to get in early than not, and of course that's true for almost any condition or any symptom of Parkinson's. Do we know anything about prevention? People are asking about, well, if these things can be so effective once I start having voice problems, what about doing some of these things before I have the problem?
I don't know, honestly, that there's been any research done on prevention of speech or swallowing problems. I think there's no side effects. It's easy enough to do to practice these techniques on a regular basis. Speaking more loudly, more clearly, on a regular basis in efforts and attempts to prevent these things from happening. So I don't know that there's any research or data to back that up, but I don't think there's any problem or side effects to doing it.
And people are also asking, Rachel, about the dangers associated with swallowing, because while obviously communication skills and speaking have a high degree of impact on the quality of someone's life, swallowing can actually lead to some real health concerns. What are those?
So the biggest things that we would worry about would be something called aspiration pneumonia, where you swallow something down the wrong tube down into the lungs and get an infection and pneumonia as a result of that, or obviously choking on something. So if you're noticing that you're coughing regularly while eating, or if you're choking, two things. One, as we mentioned, talk with your doctor right away, because we do want you to undergo those swallowing studies that Samantha mentioned so that we can see what the problem is, get you to somebody who can figure out what the right diet is for you and modify your diet so that you're eating the correct diet, and talking about some postures and correct things that you can do to minimize the risks of choking or swallowing things down the wrong tube. And then the other thing that we do recommend is that your spouse or your caregiver or your family members, friends, learn the Heimlich maneuver, because that is a life-saving procedure that people can know to minimize the risks of choking.
A couple of questions, Samantha, coming in on whether or not there are programs that people can do on their own. Both you and Tom have spoken about the importance of staying the course with it, not kind of dropping it once you go through the official coursework. And that's why I know you have your Loud Crowd, your maintenance group, where people get together and continue to talk. But people are wanting to know if there are programs that they can sort of practice at home.
I think because of the sensory deficits of people not being aware of the issues, I think it really is important that they work with a trained speech-language pathologist. However, any kind of using intent all the time is great, counting aloud, even, the days of the week and the months of the year, and using a sound level meter and trying to get which you can get on your phone. You can download a free app, a sound level meter app, and trying to project your voice more while you're doing those things. But if they're having an issue, what will happen, people with Parkinson's, they make such fast progress. Within 1 or 2 sessions, the patient will be better. So I hate for people to go on their own practicing when, honestly, if they work with someone who knows, who is trained in it, they will be better by the end of the first week, no matter which treatment they do.
And Samantha, a quick answer, if you would, to an important question that's come up, which is whether or not these programs are available to non-English speakers.
Actually, Parkinson Voice Project right now is translating our program into Spanish. However, we have treated a number of patients who speak other languages. We've had people come from other parts of the world to come be treated too, and we're able to do the treatment with them. We usually have a family member there that can translate. But yeah, no, these exercises can be done in any language.
Rachel Dolan, there are a number of people asking, or again, raising the question of singing that you touched on before. Someone is saying that sometimes it's easier to sing than to speak. Someone else wondering if singing can increase volume. Is the thought there that it's both volume and, as you were saying earlier, a question of rhythm, that there's just something that, like being able to ride a bike, that gets you kind of going again?
You read my mind, because I was going to bring up the correlation with cycling, and how people, there are people who really can't get going with walking, and then you get them on a bike and they're in a rhythm and doing just fine, and then their walking improves. So same kind of idea with singing. I think the volume and the pitch can improve, and there have been, again, small studies that show that the people's voice volume and pitch do improve, at least temporarily after, and the social interaction of singing in groups is also beneficial.
Samantha, a question from Debbie, who says, my husband started talking out of only one side of his mouth at times. Is that something that could be Parkinson's related? I know these things are tricky, and of course you can't diagnose over this podcast, but because there could be, just because someone has Parkinson's doesn't mean there couldn't be other things going on as well. But does that ring any bells with you?
I've never seen it happen before. Maybe it could be related to the decreased coordination of the movements, or they've just gotten into this habit of doing that. But I would think that could be corrected unless there's an issue not related to Parkinson's that's causing that.
Rachel Dolan.
When we talk to sometimes about medication side effects, sometimes dyskinesias can affect the musculature of the mouth and the face. And so sometimes if the medications are causing dyskinesias or even dystonic movements, that can affect the face as well. So it may be worth noting, if that's happening at a specific time or if it's correlating with the medication administration, just to see if that might be playing a role.
You mentioned the word dystonic, and one person wrote in about dystonia. I think of dystonia as being these intense muscle cramping. Is that something that can happen in the face as well, and therefore would affect speech or swallowing?
So dystonia, simply defined, is an abnormal posture or an abnormal involuntary movement of the muscles. So it can affect any muscles of the body, including the muscles of the face, also including your vocal muscles. So it can affect the voice muscles. It can also affect the muscles of the face, as I said. So it really just depends what part of the body it's affecting and when. So it certainly can affect the voice and again, also the muscles of the mouth.
We just have a few moments left, so I want to give Samantha and Tom each a last word. And Samantha, from all of this, it seems like a number of points are worth underlining. Don't wait. If you're noticing, as Tom Boyd did, problems and having your dinner order taken by a waiter, pay attention to that. Get in early. Getting in early makes a difference. Stay the course with it. This is something that you have to continue to work on. What other takeaway points, I guess, would you most like people to come away from this session thinking about?
I think that people with Parkinson's need to learn how to live their whole life with intent, to realize that things are not automatic. They're going to have to think about it, but also to recognize that all of us use intent all the time. When we went on our first job interview, we used intent. When we're driving down the highway and get caught between an 18-wheeler and a concrete barrier, all of a sudden we start using intent. So it's not a new concept. I think everybody can do it. And I wanted to mention about the singing. Singing is great exercise, but please do it with intent. Use a sound level meter and try to put forth more effort when you're doing that. And that would be great exercise.
And Tom Boyd, a last thought from you. You gave us such a great demonstration of all those M sounds earlier, and I wish I could listen to you read from To Kill a Mockingbird when that anniversary not so long from now. But some last thoughts from you about both the challenge that this has presented you, but the way in which you've been able to meet that challenge.
Well, I think it's most important to realize that Parkinson's is a disease, but it's also manageable. And it's just like we try to overcome it, and overcome a Sudoku puzzle or drive when we first got our driving license, it's something you need to work on. Excuse me, now I'm having a bad voice. Sorry about that. Something you need to work on and realize that there are organizations like Samantha's and your MJFF and places that will help us and live with the disease and live a wonderful years of our life.
Well, Tom Boyd, thank you very much, and best of luck when you do that marathon reading. That sounds like a wonderful project and a wonderful testimony to the progress.
Thank you very much, David.
That you've been able to make. And Samantha, too, thanks very much for your participation, as well as Rachel Dolan's, and a reminder that if you want to download our resource list, that'll help you find these sorts of resources in your area, whether it's those that are provided by the Parkinson's Voice Project or the Lee Silberman voice training. And as Samantha, I think, importantly noted, it's important to find someone who knows something about Parkinson's. Not all speech pathologists would, and so it's important to find someone, just as we often say it's important to find a movement disorder specialist. In this case, it's really important to find a speech or swallowing person who has a particular interest and expertise in neurological disorders. So thanks to all of you, to Tom, Samantha, and Rachel for participating. We'll be sending a link to the webinar so that you can listen again on demand and also share it with others. So there will also be a survey link in that email. And we hope you'll share with us your thoughts on today's presentation as well. A reminder also that if we didn't get to your question today, you can join us for our Twitter chat on this topic. That's at 12 noon Eastern Time tomorrow. The hashtag is FoxPDChat. And in July, our third Thursday webinar will be on July the 16th, 12 noon Eastern. And we're going to take up in that webinar the topic of constipation and why that is not only a problematic symptom of the disease, but why some researchers actually think that that may be a signal of something going on very early on in the disease, that constipation may be a warning sign actually for Parkinson's. So we'll take up that difficult problem, but also the really interesting research that's going on to try to solve it. So thanks everyone. Thanks for joining us for today's Third Thursday webinar, and we'll hope to have you join us again next month.